Welcome to Med-Surg Mini number 23, Asthma. Asthma is a chronic lung disease that's intermittent and has reversible airway obstruction due to inflammation and bronchoconstriction. The pathophysiology of asthma is that individuals exposed to an irritant, which causes an inflammatory response and release of IgE antibodies. Typical irritants can be cigarette smoke, mold, pollen, dust, animal dander, air pollutants, and occupational irritants. Once those IgE antibodies are released, degranulation occurs, releasing histamine and leukotrienes. This causes vasodilation, which increases capillary permeability and drainage, causing edema around the airways. Edema then attracts basophils, eosinophils, and neutrophils. These particles increase and thicken secretions that can then obstruct the airway. Lastly, histamine causes bronchial spasms. This is seen more commonly in women, as well as women of African American descent, American Indians, and Native Alaskan populations. Risk factors for asthma include viral infections, nasal polyps, allergic rhinitis, food and medication allergies, emotional stress, family history, respiratory infections, eczema, and allergies. Symptoms include wheezing, dyspnea, coughing, increased sputum production, increased respiratory rate, chest tightness, tachycardia, hypoxemia, anxiety, inability to speak, accessory muscle use, and decreased peak flow. These symptoms can progress very quickly into a life-threatening and medical emergent situation. The way that we diagnose asthma is through a pulmonary function test such as spirometry, peak expiratory volume testing, and pulse oximetry. We also would evaluate family history as well as history of allergies, and we would do arterial blood gases, a CBC, and a chest x-ray to rule out any other disorders. Management would focus on prevention of an asthma attack. This would include avoiding triggers, using air filtration, and avoiding any fumes from stoves, fires, aerosols, or perfumes. Non-pharmacologically, we can teach them anxiety and stress management, deep breathing techniques, and sitting in the tripod positioning to help improve respirations. As far as medications go, we would put them on long-term medications to prevent any exacerbation, and then we would also provide them with rescue medications, typically in the form of an inhaler. These medications include anti-inflammatory medications, bronchodilators, which would typically be our inhalers, anticholinergic medications, and leukotriene modifiers. As far as nursing interventions go, we would do medication administration, oxygen, and assess for any complications of severe asthma attacks, and we would do any resuscitative measures that are needed. Considerations is it can lead to mucus plugs, respiratory distress, carbon dioxide retention. It can be life-threatening, requiring an endotracheal tube, and our main nursing problems would be ineffective airway clearance, impaired gas exchange, ineffective breathing pattern, and anxiety. Education would be to avoid any risk factors, teach them pursed lip breathing during an attack, teach them smoking cessation, and help them to properly use an inhaler and a spacer. We would also want to educate them on how to sanitize both their inhaler and spacer in between use. And that wraps up our discussion on asthma.